Peter Pitts is joining me right now. He's the former associate commissioner for the FDA. Thanks for being with us. This report, it cites a number of shortcomings within the agency, one of which said competing priorities are preventing the Human Foods Program from protecting public health adequately. What does that mean?
Well, thank you for having me on. What does that mean? It means nothing. It's an excuse. The finding from the Reagan-Udall Foundation was very clear. There's management dysfunction, crossing and incomplete lines of communication, and a lack of expertise, in the commissioner's office. When I was at the FDA, the deputy commissioner, the number 2 person at the FDA, was a food expert and acted as the chief of that center for oversight purposes. The main finding of the report was the FDA needs to do a better job and focus on the food center. No surprise there. But it really doesn't say anything about some of the major problems, such as identifying products like baby formula that are only made by a few companies. And when one regulatory action can cause a nationwide scare for baby formula, we've got to really start thinking about identifying what types of supply line issues the FDA has in general and the food center specifically.
The report also suggests creating this separate federal food administration outside of the FDA. Do you think that would help?
I think that's a bad idea. I think that, obviously both the Department of Agriculture and the FDA have food responsibilities. It works very well when the system is properly constructed. The FDA has holes in that system. It's a management problem, it's a communications problem, and of course it's a funding problem, and I'm sure the FDA will bring that up as well. The technology that the FDA uses to oversee our food supply is antiquated and needs to be fixed. So clearly budget is going to be an issue.
You're saying it's antiquated, there are communication issues. Some of the companies, apparently, these baby formula companies, cut some corners. There were issues that were not found in time by the government. Unsanitary conditions at the Abbott plant is just one example. Beyond more regulation, what would you say is the answer?
Well, the FDA's got to be a more robust regulator. They've got to make sure that industry understands who's in charge. Clearly, there's a partnership. Industry and government have to work together. They've got to be colleagues. But at the end of the day, the FDA has the authority to make things happen, and they've got to take charge and make sure that authority is understood so that industry can't undercut the FDA's mission of a safe and effective food supply for Americans.
And in terms of the budget, the report said the $1 billion the Human Foods Program received was insufficient. Where would this money go, and why is more funding needed?
Well, clearly, you need a complete revamp of the technology infrastructure. That's not inexpensive. The FDA needs more inspectors and the training to make sure those inspectors can get the job done. And they need basically a whole new arm of enforcement to make sure that when they're dealing with industry, they are the first among equals, and industry says, yes, sir, when the FDA tells them to do something rather than litigating or dragging their feet.
Peter Pitts, former associate commissioner for the FDA, thank you for your time.
My pleasure. Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.